Doctors worried about hospital patients overdosing are once again setting up a pop-up overdose prevention site near Victoria's Royal Jubilee Hospital.
Sadly, we are at this again.
These tents provide a safe drug use space for hospital patients who might otherwise use illicit drugs alone in stairwells, bathrooms, off hospital grounds, often to fatal results.
I think it's a huge disservice. People will still be using their substances, and unfortunately, when they go outside the hospital, people are passing out and dying.
Sanctioned overdose prevention sites were planned for Nanaimo Regional, Royal Jubilee, and North Island Hospital in Campbell River. But on government direction, in April of last year, those sites were put on hold as nurses complained patients were smoking and injecting street drugs inside.
It does appear that it's providing allowances for consumption within the healthcare setting.
A public outcry followed, putting pressure on the province, which responded by rolling back its decriminalization project prior to the provincial election. In February, BC's new health minister said they were reviewing the site's standards.
We are developing minimum service standards for overdose prevention sites, and when those are finished, we want to make sure that they are thorough, that they are done well, and that they serve everybody.
It's a notion doctors here reject, standing by the work Island Health had already done, pointing to similar sites on the Lower Mainland that have been operating for years.
I think it is a lack of political will at the provincial level.
A similar pop-up site has been set up outside Nanaimo Hospital for all of 2025 so far, providing needed care, but also intended to draw attention to what doctors say is an unfulfilled promise.
I guess one of my biggest frustrations is watching politicians make decisions on medical care for my patients. You know, I'm not a politician. I don't pretend to be a politician, and I would appreciate it if politicians didn't pretend to be doctors. We're the ones that need to be making the decisions with our patients.
They say this pop-up will periodically be set up until the government gives Island Health the green light to put in overdose prevention sites inside island hospitals.